Hi, welcome to Case of the Day. This is Dr. Bhavin Jankaria, and today we're looking at the 13th case. So we've made it to week 4. It's 4 cases a week: Monday, Tuesday, Wednesday, Thursday. And today we have two patients with multiple lung lesions, slightly different. But the question is, what do you think they are? So, 23-year-old, 10 days history, fever on and off, no weight loss, but has chest pain. You see all these lesions with air bronchulograms, bronchograms. They're mass-like lesions. There's a right pleural effusion. These lesions are necrotic, and you can see the pleural effusion. On the slightly delayed images, there are supraclavicular and internal mammary nodes and marked necrosis within the lung lesions. Now, if you look at multiple lung lesions and mass-like lesions, these are the various thoughts that you would, or these are the various conditions that you would think of. And the way to reach a diagnosis is to do it on the CT itself, assimilate the clinical information, and then suggest a test to arrive at a biopsy. And reaching a diagnosis on the CT itself depends on distribution, shape, internal characteristics, external characteristics, associated findings. So our patient basically has necrotic lesions, ill-defined margins, mass-like but with air bronchogram. So they're basically uh, pneumonic lesions but rounded with effusion and nodes, and it's an acute condition. So if you put all of this together, the most likely possibility is infection. And given that this is India, tuberculosis would be first. I did a biopsy in the morning, and there was pus-like material that came out of the necrotic component, but it wasn't foul smelling, etc. So that's gone for testing. And then the next patient was a 42-year-old, 3 weeks history, no supporting test positive, TB PCR or gene expert for sputum negative, ANCA results awaited. Slightly different, there are subtle air bronchulograms, but there are ground glass halos, and there is a little bit of septal thickening. There is a right pleural effusion, there is a right supraclavicular node, and the lesions are necrotic on the contrast study, and there is mild to moderate uptake. So again, if you look at all the causes, that's the list here. This is the way in which you would try and reach a diagnosis. Again, we're looking at randomly distributed lesions, necrotic, ill-defined margins, ground glass halos, etc. And so if you look at the peripheral halo bit, then we have this set, and it's highly unlikely that this is invasive mucinous adenocarcinoma. So we're again in an acute setting, thinking of infection and vasculitis. So did a biopsy in this manner of the upper lobe lesion, and now we're going to wait for the answer. So multiple lung lesions are difficult to triage on just the CT scans. What we would do is describe them, make an assessment based upon the characteristics of the lesions. Most of the times we won't really be able to come to a definite diagnosis. We should assimilate the clinical information and then suggest the next steps. And most of the times you need some form of biopsy, whether it's bronchoscopy guided EBUS or CT guided. In this case, CT guided was chosen for both the patients. Think about the diagnosis. We have 3-4 days before the results come in. Once they come in, I'll put them in the description as well as in a YouTube post referencing this video, and see how you matched up compared to my thinking, and then what the final answers are. That's my WhatsApp channel. Thank you so much for listening and viewing.